basically what we were formed to do in 2011. It was really a public health response to the fact that we were starting to hear that people had some concerns and health concerns associated with unconventional natural gas drilling. So we look at that, and we're basically trying to provide an on-the-ground, targeted, timely public health response. We are currently looking for a new nurse practitioner, but we have had a nurse practitioner on staff who does comprehensive evaluations of people and tries to determine whether or not their health concerns may be associated with natural gas drilling. And that's determined by the fact that, you know, whether or not it was a pre-existing condition, whether it happened in conjunction with some of the drilling activities, various things like that. So again, this is what we do. We have a nurse practitioner. We will have a nurse practitioner again soon. Do health exams. I do a lot of work with medical professionals to try and educate the medical professionals about what's happening. And then we do exposure assessments, and we help people in the community figure out what to do and how to reduce their exposures themselves as much as possible, and with assistance wherever we can. These are some of the symptoms that we've seen in some of the people we've talked to: skin rash, irritation, nausea, vomiting, abdominal pain, breathing difficulties or cough, and some instances of nosebleeds. You know, here's some of the sort of categories of what we've seen and some of the things, but this is the slide I really wanted to get to, because here I wanted you to see that, you know, the skin issues we think are probably associated with water, eye irritation we feel is associated with air, respiratory with air, and neurological probably with air. So you can kind of get a sense from this chart that we're starting to get more concerned about air. We've redirected our focus to address more of the air quality issues because of what we've seen in people and the symptoms that they're experiencing. So I took out a lot of the stuff that we do that talks about water, and I focus this more on air because I think that's the concern here. So these are some of the things that we see as potentially problematic, which we know are found within natural gas extraction. And these are the things that we see as some problematic chemicals to watch out for. A lot of these materials are on our website too, so if I go through this really quickly, you can find it online. So this is kind of what we do. We go out, we measure people's air. What we typically do is we measure particulate matter. We've got a fairly inexpensive device that measures particulate matter, and that's literally like very fine particles in the air. The problem with those fine particles, which is something like diesel exhaust, is that depending on how fine they are, they can actually carry pollutants into your lungs and into your bloodstream. So if you had something like, for instance, diesel exhaust by itself, it would be potentially problematic, but in conjunction with toxic chemicals, it actually serves as a carrier, and it takes it into your body, and so it worsens the effects. And so what we do is we use particulate monitors as basically a surrogate to alert us to when there are spikes in particulate matter, and that way we know that, you know, there's potentially issues with the air pollution, and people should basically reduce their outdoor activity depending on how bad it is, filter their indoor air, leave the area, you know, kind of worst case scenario depending on how high the spikes are. And I will say at this point in time that kind of normal background levels, you know, under possibly not the greatest conditions, might be 2,000 to 3,000 of a certain type of particulate matter. We've seen spikes as high as 17,000 in people's houses. The worst case scenario that we've found so far is if you're near a processing facility. So compressor stations are not good. You know, multiple compressor stations, if you're downwind from these things, not really all that great, but the processing facilities seem to be the worst. You know, what we really try and do is tell people there are things you can do. Certainly in this scenario, these things might look like minor things to do, but they really do make a difference. You can work to control the indoor air in your home. We do have indoor air filters that we recommend, at least one that we think works really well. You know, just try and keep this stuff from coming into your house as much as possible. And even though it does seem like a fairly minimal solution, it can make a big difference in reducing your exposures inside. This is basically our new air monitoring guidelines that we have just put out there within the last week, literally, for people to understand what is going on with your weather, what is it that's around you, and how is that actually impacting the amount of pollution that's coming your way. And this, of course, is all very pertinent to the Summit School, but this just I'm just going to kind of walk you through some stills from the video. I encourage you to, again, go online and check it out. So, you start to look at different things. You start to say, okay, can I identify where the facility is that's polluting my space? You of course have to think about multiple facilities and try and map all of the different things which might be around you. So, start there. Then what you're going to do is figure out how far away you are. The good news is, and this is not necessarily great news, but the good news is that if you were maybe 2 miles away, not such a big worry. If you were, even a mile away and you were not downwind from something, not as much to worry about. If you were half a mile away and you were downwind, you might have some quite a bit to worry about. And that depends on the weather conditions. And so that's what we're really trying to teach people, is that under certain weather conditions, it's going to actually disperse the pollution. It's not going to come to you in as great a concentration as it would under, say, cloudy skies. Nighttime conditions typically are when you may have to be more concerned. But anytime the air is still, basically what it's doing is it's concentrating the pollution on you, and especially if it's overcast. So if you have a combination of it being overcast and still, you're going to get higher concentrations of pollution. And what direction is it from you? Is it upwind from you? Is it coming towards you? Is it going away from you? I mean, of course that makes a big difference. And what I was mentioning, what's the weather like? Is it cloudy? And then what we've done, and this is in the materials and the handouts I've given you, is we've ranked this. So we're using EPA standards. These are baseline standards that we feel are fairly accurate, but given the fact that there's multiple facilities around some people, you want to be as protective as you can be. So we've color-coded things, and we're trying to give people a sense of what it is under certain circumstances you have to be concerned about. And when we talk about very unhealthy, you pretty much, don't want to have a lot of activity. If it's unhealthy for sensitive groups, and you might want to reduce the activity of your children, anybody with a compromised immune system, things like that. Moderate, it's okay. And that's one of the things we're trying to tell people too, is that under certain circumstances, it may be okay. And it may be okay possibly more often than you think, and we really want to try and put that information in people's hands as much as we possibly can. VOCs, volatile organic compounds, again, these are things that get associated with the particulate matter and can cause problems for your respiratory health. These are just some more stills. This just shows kind of an example of there's the pollution facility. This is how close you are, and these are some of the polluting levels you might get under these different weather conditions. I have a tremendous amount of detail on this. I can take you as far as you want to go down the rabbit hole, so to speak.
Or even further.
But we also have a simpler version. So we're trying to give people kind of a full range of options to understand. Again, the wind speed matters, the cloud cover matters. It all can have impacts on how much pollution you're getting. So again, for more of this, I would recommend going to our website. I hope everybody can see this. As our website, it's on all of the paperwork that I handed out, and that's actually where the video is, so you can watch it online. So, and that's just our foundations that have supported us. We're all private foundation funding. These are again some recommendations. You can really take control of the situation as much as possible. Again, you want to look at the situation. You want to see how much of an exposure are you getting. Is it severe? Is it minimal? What is it that will make you feel comfortable? And what is it that you feel will be protective of your health? This is what we do. So one thing I really want to encourage people to do is, document, like pay attention to what's happening to your health, pay attention to the conditions around you, and try and gain control of the situation, at least to the extent that you know what's happening around you. And if a health symptom, for instance, started occurring, you would have some sense of when it happened and what might be happening nearby. And that's information that hopefully, ultimately, your primary care provider, your physician, your healthcare provider should be able to understand. And that's one of the things that we want to try and do, is help them understand what these things mean. This is our team, huge group of people, a lot of expertise. And you know, these are all the people we collaborate with. We're working with schools of public health. We're working with some nurse practitioners. The Carnegie University's Create Lab is fantastic about getting devices out to people. We're going to try and have some more air monitoring devices available for people. Primarily, we work in Washington County, but I'm trying to kind of, push information out there as far as I can. You know, what we did with the Summit School Alert, honestly, the situation came up. I talked to Diane. I knew what was happening. I consulted with some of our research assistants, and I said, look, can we just make something happen? Because we have this information. Let's give people some sense of what is actually going on. It turned it right around for me. We got it out the door. We have no red tape. We're not a bureaucracy. We're not state funded. So, we're very rapid fire in our response. Unfortunately, you're not going to get that from a state agency, which is underfunded or not funded whatsoever. So we kind of fill in the gaps. That's very quick. Yes.
So if you have multiple facilities around you, or will have,
yes,
you suggest having an air filtration system in your home, plus the air monitor.
Here's what I would suggest. I would suggest certainly keeping track and monitoring it. If you are within half a mile to a mile from these facilities and you are downwind of them, I would definitely recommend having filtration devices inside your home.
And you have a system that you would recommend?
Yeah, actually the highest level one, which we brokered a deal with them to get it at a reduced cost. It's not cheap, but it's extremely effective. It's called the Austin Air Health Mate, and there's information on our website about that. The thing about the Austin Air Health Mate versus some of the standard materials you might find, like, you can get a HEPA filter at a lot of different places.
Yeah.
But what the Austin does is it doesn't just remove particulate matter and dust and things like that, it actually removes the chemicals from your air. So we feel like the Austin filter is much more effective at actually removing some of the...
and that's on your website.
It's on our website, and we have a discount offer for people.
Oh, great! Now we emailed you about an air
I'm
monitor.
gonna move over here so I'm not staring at the
We
spotlight
did
quite so much.
email you about an air monitoring system, and you
Yes.
recommended one. On the one comment you made, you said you could get a less expensive model if you didn't need a PC hookup. So is that primarily just to track it on your computer that you want
Right.
that?
Yes, and that's what we do, of course, is we download that data and we produce reports for people. But if all you wanted to do was have a constant monitoring system, that you didn't necessarily want to capture the data or download it onto a computer, you could get. And it's for everybody who's not familiar with this. Again, a lot of this information is on our website, but it's called the Dylos, which is spelled DYLOS. It basically, it's actually a really effective, fairly inexpensive, and when I say fairly inexpensive, I'm saying like, it's $300 essentially, or just under $300. But this is comparative or comparable to devices that could cost upwards of $100,000. So for $300, you get a sense of like what your air quality looks like on an ongoing, constant basis. So you can have one of these running in your home. It's about this big. Well, it's just kind of smaller than a bread box, but it's about this big.
Yeah.
It's just a little unit. It doesn't take a lot of electricity. It's very simple, easy to use, and we found it's really effective for people.
So it would be a good thing to do if you had facilities around you, at least
Yes.
to track and see, and then if you need a filtration system, go that direction.
Exactly, and so this kind of gives you that sense
Right.
of, yeah, I've got a problem, or my air quality actually isn't that bad.
Okay, good.
And because we've been using the Dylos for a lot of community members, we have a really robust kind of a support system in place that will explain it and kind of give you some sense of what your results mean.
Okay.
Dan.
What about for a school system? I mean, would this Dylos work if we can get the school to say, you know, we really need to monitor the air in
Yeah.
here.
We feel
Would
like
that work, that $300?
Yeah, I mean, again, you know, with the understanding that it's not going to tell you what the chemicals are, but it's going to show you spikes in basically like a diesel emission or any sort of nearby, you know. So we feel like it's actually a really good surrogate. And again, it's inexpensive, it's simple, it's easy to use, and it basically, you know, as long as somebody's paying attention to it, it's a fairly effective warning system. So we feel pretty strongly that this is a good tool. Yes.
Are you working with schools and school districts at all?
Not really to this, not right now. And I know of, you know, efforts that are happening like down in Texas to do some surveillance activities. But as of this date, no, we haven't really started doing that yet. You know, we're here for anybody who comes to us, and we're happy to work with them. But they kind of have to come to us at this point. We're not going to go out and really drum up business because we just don't have that much of a capacity.
Do you have any idea if the processing plants operate in the day and the evening?
Yes, they do.
weekends,
Yes. And so it's
24/7.
really important to watch and to track what's happening at night in particular. And if any of you, you know, are close to a processing facility, I highly recommend you minimize the air coming into your home at night. It really does, from what I've seen from these particulate meters, it really makes a big difference at night.
We live near one, and we suspect that they operate more at night. because
Yes,
once
we
in a while we'll
often
wake up
see.
and say, "What's that smell?"
Well, that's the thing, and the thing about it is too, if you were, for instance, cooking, you know, we often use this example, like if you made a steak dinner at home, your particulate matter could go up, say, 6,000, 7,000, 8,000, right? But at 2 o'clock in the morning, if your particulate matter reading is 17,000, we know you're not out there vacuuming unless you're insane. I mean, some people might be, but it's probably not likely that it's happening inside your home at 2 o'clock in the morning that you caused that kind of a spike. And so we're seeing that. I mean, again, that's kind of worst case scenario. This is really in close proximity to a major processing facility. So, you know, again, there's evidence, clear evidence that they do activities at night, and they may even actually do more. So, which shouldn't really be happening. But.
What do you consider really close to a process facility?
I would say anybody who's within half a mile or less. So really the half a mile range is what we start to have serious concerns about. You know, when you're a mile away, you're not necessarily going to be getting the same kind of pollution levels, but anything within half a mile, I would be concerned about. Yes.
One last thing, and that, I mean, maybe not the last, but for me,
Okay.
Summit Elementary, going back to Summit Elementary. Okay, within a mile and a half of Summit Elementary, there are 16 wells.
Yes.
Now, they're not all downwind, but does that, I guess, make their problem that much worse, or?
Yeah, it's definitely a cumulative thing, and so what we did, unfortunately, for better for worse, with our model was we used whatever data we could find that was readily available. Primarily, you know, some of the DEP inventory, which is single source, right? So we weren't able to effectively create a model that took into account multiple sources. But you can only imagine and believe and understand that, you know, it's a compounding factor. So I would say any facility that's going to be basically, you know, the pollution is coming towards you, you would want to kind of count those in and add those on top of each other. So, you know, depending on the prevailing winds and where the direction, of course, is. So, I wish I had better news.
When I
Yes.
found out that they were going to be fracking the schools in Armstrong School District and also potentially next to one in Karnes City Area School District, I did communicate with DEP, and I was really surprised to find out that there's absolutely no difference in the regulations as to whether they're fracking 500 feet from my outhouse or an elementary school
Yes.
or a senior citizen's home.
Oh yeah,
There's no difference between an empty barn
right.
and an elementary school. There are no rules. There's no plans to monitor anything or restrict in any way or to pre-test, post-test. They have absolutely nothing on the books.
Right. You're right. So, I don't really have much to add to that. That's right. So, okay, so I did bring one document, and it's a pale attempt at good news, but at least it shows at least tiny bit of movement, at least at the federal level, which I thought was going to be helpful for some people, and I can just kind of hand it off to you and point out some things to you, but I'll just hold it up so people can at least see what I brought. And this is something that, that I'm sure you could find online. I have a link to it, but this came from EPA, and it says, I'll just read it to you. EPA needs to improve air emissions data for the oil and natural gas production sector. So again, cold comfort, but at least it acknowledges the fact that they don't really know what's going on. So, for what that's worth. But it's saying, it's to some extent, at least, slightly acknowledging there might be a problem here, but we don't really know what it is. So do you want me to just leave this with you? And
Okay.
I got this actually from one of our consultants who worked on the alert for us, because she said there's some data in here, specifically tiny little bit of mention about flaring. So I'll just kind of point that out to you, but then I'll just leave this with you, Diane.
Okay.
I feel like movement is slow to happen. It's definitely not going to start in Pennsylvania. But whether or not it starts to happen at the federal level, or, certainly in states like New York, which are light years ahead of keeping this out of their state, that could eventually have an effect on us. Eventually. But in the meantime, please understand that you have to do what you can to protect yourself. And to some extent, I hate to say it, but it's up to you, and it's up to the parents, and you have to really figure out, what is it that my children are being exposed to, and how can I best protect them? And how can I best protect my house? How can I keep my house clean? Do what you can, and quite honestly, not to downplay any of the very real health effects. The stress inherent in this is overwhelming. And I know we've seen people who have just basically said, we've got problems here, and they're certifiably anxious and stressed and all sorts of things, but they'll deny it till the cows come home, and yet they're kind of breaking apart. So do what you can to protect yourself, to make your home healthy, to make yourself healthy, to try and reassure, not gloss over problems, but try and take control of your situation as best you can, because that can go a long way towards improving the situation. And it really can make a difference in reducing your exposures.